Video Foot Doc, here with another video for you on all things foot and ankle. One question that I am often asked is about an area on the outer side of the front of the ankle that often appears puffy in many people. Many people are concerned about this and often ask me for an explanation of what it is. So I figured I'd create a video for you to explain exactly what this lump or this mass usually is, and what sometimes it can be that might actually pose a problem. The area that I'm talking about is on the outer side of the ankle. If you look at this bone model, here is the ankle joint right here. And here's the big toe and here's the little toe. Well, on the outer side of the ankle, just in front of it, often people have a very puffy, large area. I usually see this in women, not so much in men, although it can be present in men, where the side of this ankle will appear a bit puffier than the rest of the surrounding tissue. And this is different than if you were to simply have swelling of the entirety of the ankle or swelling of the foot and the legs. This is actually something that actually is sort of a mound that kind of rises over this area. What usually this is it usually is simply a enlargement of fat tissue or greater level of fat deposition across the front of the ankle. Sometimes this is placed by the body simply for protective purposes, and sometimes it just simply forms there. On very rare occasions, this can actually represent a tumor of fat tissue in which the actual fat tissue itself is too enlarged. Now, the vast majority of the time, this is simply a benign process, although on occasion there can be cancerous tumors of fat tissue itself, although this is usually quite rare. Another explanation for this is that some people just happen to have more fluid retention on that side of the ankle than in the rest of their ankle or in the foot or lower leg itself. And so sometimes it's just simply a depositing of extra fluid, edema is what we call that, which actually just simply forms to that side. And that's generally harmless unless it becomes very expansive and starts to harm the overlying skin. But usually we don't see that when it's just limited to the ankle area. We usually see it if it's the whole leg that's swollen. One final explanation is on this same bone model, an area that you can see right over here. This part of the foot itself has a muscle belly that kind of lies over the top of it. And on occasion, this muscle belly can actually become too enlarged. The muscle fibers themselves will enlarge, or something we call hypertrophy. And when that muscle is too big, you can feel it underneath the skin. Now, normally that's a little bit further away from the ankle joint itself. It's a little bit more on top of the foot, but sometimes, given all the other tissue that lies over there, it can feel like it's closer back towards the ankle itself. This muscle itself has tendons which attach to the lesser toes, which allow the toes to kind of raise upward. And so that's the function of that muscle. But on occasion, this muscle can become enlarged, and that's another explanation for why there's this puffy area in front of the ankle. Now, once again, this generally is a benign process, as muscle tumors are extremely rare. However, if you do have this area and it's either causing pain or making shoe wearing difficult, please see your podiatrist, because we can make a decent diagnosis, figure out if there's anything that is serious, or whether it's just simply a matter of it just being a benign condition that may just need a little bit more accommodation in shoes. Now, of course, if it is a mass, whether it's benign or malignant, surgery can be possible. Certainly for malignant lesions, it has to be taken care of surgically. But if it's just simply a benign mass and you have no other way of being able to comfortably fit on shoes, the mass can simply be removed. Well, I hope you enjoyed this video. Please look for more video on all things foot and ankle on this site as well as others, or you may visit my website at www.inpodiatrygroup.com. Thank you.